Welcome. Today, we're diving deep into a less common, but significant heart condition, restrictive cardiomyopathy. We'll explore what it is, what causes it, how it affects the heart, and what can be done about it. Join us as we unravel the complexities of this fascinating cardiac challenge. Restrictive cardiomyopathy, or RCM, arises from a variety of factors that ultimately lead to stiffening of the heart muscle. In many cases, the precise cause remains unknown. We call this idiopathic RCM. However, several conditions are known to contribute. Amyloidosis, a disease where abnormal proteins called amyloid accumulate in the heart tissue, is a leading culprit. Other potential causes include sarcoidosis, an inflammatory disease, hemochromatosis, an iron overload disorder, and certain connective tissue diseases, such as scleroderma. Rarer causes encompass specific metabolic disorders, radiation therapy to the chest, and certain medications. Understanding the origin is crucial for tailoring the right treatment approach. Let's understand what's happening inside the heart with restrictive cardiomyopathy. Unlike dilated cardiomyopathy, where the heart chambers enlarge, or hypertrophic cardiomyopathy, where the heart muscle thickens, RCM is characterized by rigid, non-compliant ventricles, the heart's main pumping chambers. These stiff ventricles struggle to relax and fill properly with blood during diastole, the filling phase of the heartbeat. This impaired filling leads to increased pressure within the heart chambers, backing up into the atria, the lungs, and the rest of the body. Consequently, the heart struggles to pump enough blood to meet the body's needs, leading to symptoms of heart failure. Restrictive cardiomyopathy is relatively rare compared to other types of heart failure and cardiomyopathies. Precise figures on its incidence and prevalence are hard to establish due to the challenges in diagnosis and potential underreporting. The prevalence varies across different populations, influenced by the prevalence of underlying causes such as amyloidosis. While it can affect people of all ages, it's more commonly diagnosed in older adults. Further research is ongoing to gain a better grasp of the global distribution and risk factors of this condition. The signs and symptoms of restrictive cardiomyopathy can mimic those of other heart conditions, making diagnosis challenging. Shortness of breath, especially with exertion or when lying down, is a common complaint. Fatigue, weakness, and swelling in the ankles, legs, and abdomen known as edema are also frequent. Individuals may experience chest pain, lightheadedness, or fainting. Some may develop an irregular heartbeat or arrhythmia. It's crucial to seek medical attention if you experience any of these symptoms, especially if they are new or worsening. Diagnosing restrictive cardiomyopathy involves a combination of tests and assessments. A thorough physical examination and review of medical history are the first steps. An electrocardiogram, or ECG, can detect abnormal heart rhythms and signs of heart enlargement. An echocardiogram, an ultrasound of the heart, is particularly useful for visualizing the structure and function of the heart chambers, including assessing the stiffness of the ventricles. Cardiac MRI can provide even more detailed images of the heart tissue and detect underlying infiltrative diseases. In some cases, a heart biopsy may be necessary to analyze a small sample of heart tissue under a microscope to identify specific causes like amyloid deposits. Other tests may be performed to rule out other conditions. While restrictive cardiomyopathy is a distinct entity, it can manifest with different underlying etiologies. As such, there are no strict classifications. However, it's often classified based on the underlying cause. For example, amyloid-related RCM, sarcoidosis-related M, or idiopathic RCM if the cause is unknown. The treatment strategies are often dependent on the specific underlying cause. For example, in amyloid-related RCM, specific treatments to target the amyloid proteins may be used. The treatment of restrictive cardiomyopathy focuses on managing symptoms and addressing the underlying cause, if identifiable. Medications, such as diuretics, help reduce fluid buildup. Beta blockers and calcium channel blockers can help control heart rate and rhythm. Anticoagulants may be prescribed to prevent blood clots. In some cases, treatment is directed towards the underlying cause, such as chemotherapy for amyloidosis or immunosuppressants for sarcoidosis. A heart transplant may be considered in severe cases that don't respond to other therapies. Lifestyle modifications, like a low-sodium diet and regular moderate exercise, can also improve quality of life. Preventing restrictive cardiomyopathy is often challenging, particularly when the cause is unknown. However, managing underlying conditions such as amyloidosis, hemochromatosis, and sarcoidosis can potentially reduce the risk. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding excessive alcohol consumption, can promote overall heart health. Awareness of family history and genetic predisposition may also be relevant. The prognosis for restrictive cardiomyopathy varies widely, depending on the underlying cause, the severity of the condition, and the individual's response to treatment. Some individuals may experience stable disease with relatively mild symptoms, while others may face a more rapid progression to heart failure. Recent research is exploring new treatments for underlying causes like amyloidosis and evaluating novel therapies to improve heart function and reduce symptoms. Studies are also investigating the role of genetics in the development of restrictive cardiomyopathy, potentially leading to new diagnostic and therapeutic strategies in the future. With advancements in research and personalized treatment approaches, there is hope for improved outcomes for those living with this condition.